I spend a lot of my time talking to patients and parents of patients about myths surrounding the entire idea of tongue ties. It's such a confusing topic that confusion causes controversy. In fact, I've become very passionate about trying to clear that up and why I as a dentist even care about tongue ties to begin with. The biggest and most compelling thing that needs to be cleared up is not all tongues need treatment, not all lips need treatment, not all tissue is restrictive in nature. Only if it's restrictive and only if that restriction is causing dysfunction does it need intervention. You cannot make a diagnosis of whether something is a tongue tie or a lip tie by photos alone. Sometimes something is very obvious, you can see the tongue tie across the room, but often it's diagnosed based on the way the tissue presents in the mouth and how it feels. Does it feel restrictive? Is it limiting movement? Are you noticing that when the tongue lifts, the body's compensating by using other muscles that shouldn't have to move in order to make the tongue properly work? So it's very confusing because there's not a lot of consensus in what is and isn't a tongue tie. It really takes a lot of extra training to know what you're looking for and how to diagnose it to begin with. So that's one of the biggest issues I deal with, is making sure that that's cleared up and parents feel confident in how I'm making my decision to treat or not to treat.